Hi, everyone. Welcome to the Inspire Spark podcast, where we feature inspiring individuals from various fields. I'm your host, Siren, and today we have a special edition in support of Mental Health Awareness Month. And joining us is Dr. Timothy Low, a true exemplar of leadership and motivation. He's here to share his invaluable insights on leadership and mental health with us. Dr. Tim is a healthcare leader and medical doctor with over 30 years of experience in both public and private healthcare sectors. Dr. Tim has served as the CEO of Gleneagles Hospital and the CEO and board director of Farrer Park Hospital, among other significant roles. His remarkable contributions have earned him numerous accolades, including Best CEO of the Year in 2017, LinkedIn's Top Motivational Speaking Voice in 2023, and Top Hospital Sales Voice in 2024. His dedication during the COVID-19 pandemic was honored with Singapore's Public Service Medal in 2023. Thank you for joining us, Dr. Tim.
Hi, Siren. Glad to be here.
Thank you. Let's dive right in. You have held leadership positions across various sectors within the healthcare industry, from hospitals to contract research organizations to investment firms. How has your diverse experience shaped your approach to leadership, particularly in navigating the complexities of the healthcare landscape?
Well, if you look at leadership, the basic leadership approach that we have has not changed over the past 20, 30 years. It's basically, you need to make sure that you're authentic, that you have your people at heart, that you give of yourself. And what I practice is mainly servant leadership. And servant leadership, I'm here to serve and not to be served. So that's a very important mindset that I would like to inculcate in all the leaders, and also that's what I do for the organization. Because if everyone is there to serve, whether internal or external customers, then we'll all be benefiting, and the experience that our internal and external customers that they're going through will be a very, very great experience. So what I want to also impress upon is that in leadership, we need empathetic leadership. And by that, I mean, we need to put ourselves in the shoes of our customers, our staff, and be humane, right? We need humility, we need humanity to manage people, because people are people, right? They have feelings.
Yeah, I really love what you just mentioned, humanity and also servant leadership, which I also advocate when I train my leaders during leadership skills programs. It's really about that care and empathy that we show to people. And oftentimes what I observe is that leaders sometimes, because of the pressures to deliver and the fast pace of work, right, they tend to be more task focused and lack the human touch.
Well, what's important is the humanity in it, and what is one thing in all the staff that I have, all the organizations that I've been in, is that they want to be trusted. They want to feel that their leaders trust them, and in doing so, I need to give them empowerment, because without empowerment, they will be very slow in responding, and they will feel that everything that they do, they need to check with their supervisors. And in that sense, it will be micromanaging in terms of whatever they need to do. And the worst thing that a leader can do is to micromanage all your staff.
Exactly.
Because when you get good people on board, right, you just give them the scope that they need to do and be in, and then empower them. Exactly. Along the way, of course, you coach them and guide them. For those people who are new, yes, perhaps you want to coach more. I wouldn't say micromanage. It's more like spending more time.
Yeah.
Mm.
Yeah. Thank you. And let's talk about your career. Your career highlights include leading organizations to achieve significant milestones, such as JCI accreditation and revenue growth. What key strategies have you employed to foster a culture of excellence and innovation within these institutions?
Well, culture building in an organization needs time. So a culture of excellence needs to start with the mindset change. We need to ensure that the organization has this mindset of providing excellent service. So in terms of training and development, just to give you an example, when I was running Gleneagles Hospital in Singapore, I wanted Gleneagles Hospital to be providing a 6-star hospital service to the patients, as well as the doctors who are also taking care of the patients. And to do that, we need to have a certain mindset change and behavioral change. So I went to the US to look at innovation programs or innovative programs. I brought in a program called fish philosophy. I don't know whether you've been to you've heard of it?
Yes.
Right. Fish philosophy is actually 4 philosophies that is being put in place. It is a book, actually. The book is called Fish. Yeah.
Yes.
So it's in Pike Place Fish Market in Seattle, which if you've been there, you would see the fishmongers playing with their customers. And everyone is happy. The customers are happy. The fishmongers are happy, right? And the philosophies are, one, choose your attitude. So before you leave home, choose your attitude, right? And then play with your customers, play with a purpose, right? Yeah. The other philosophy is be there. Be there meaning, you are there mentally, physically, emotionally with the person, whether the person is your colleague or whether the person is your customer. And I guess now it's not, people are holding their mobile phones all the time, right? And sort of answering the messages, and that means you're not there with the person at that point in time.
Yeah,
right?
be present.
Yeah, and the last philosophy is make that day, make your customers day. Yeah. So I brought in the author of Fish, Dr. Stephen London.
Wow.
Yeah, I brought him in to train all my staff. And that's something that was interesting in terms of training, development. Yeah.
Nice. One of my clients is also using this fish philosophy.
Great. I think that's something that is simple and yet effective and very powerful.
Great. Thanks for sharing. Nice. Let's talk about, in your opinion, what are the critical elements of successful employee engagement in the healthcare sector, and how do you ensure alignment between organizational goals and the needs of your team members?
Listening. Listen to your staff, because we need, as leaders, we need to give our staff the listening ear. They will feel that, they have an outlet to go to. So what I do is I have monthly like breakfast with the CEO. So I'll meet up with a group of staff every month from different departments. And for that hour, they have my full attention. Right?
Nice.
Yeah, I get to know them, they get to know me. We talk about anything under the sun. We don't have to talk about work. We just get to know each other. And then, of course, I would ask them, what's working? What's not working? What are you happy with? What are you unhappy with? Is there something that, you would like to see change in the organization. So giving them an outlet. The other component is motivation. Right? So I write every week. In fact, every Monday, I will be writing an email out to the staff, and it can be on various topics. Mainly, it's more like a motivation area which I put out, and stories that I share with them. And it's heartening to hear from them. That goes out every Monday. And when I walk the ground on Tuesday, Wednesday, Thursday, Friday, the staff, by Friday, the staff will be saying, hey, Dr. Lau, I'm waiting for your next Monday's note. They're wondering, what am I going to tell them next Monday? So it's kind of like,
very nice.
For the leader, I mean, we need motivation too, right?
Exactly.
So,
wow, it's very nice. I really love such personal touches. It makes a big difference, and it takes a lot of effort to implement and sustain such initiatives. So kudos to you for making it happen.
thank you.
Okay, let's move on. You have been recognized as one of the 50 most talented healthcare leaders of Asia and received numerous awards for your contributions to healthcare excellence. How do you balance personal achievements with the collaborative nature of leadership? And what advice would you give to emerging leaders in the industry?
Well, the awards, although there were many awards, like for when I was running Gleneagles, we had 14 both local and regional awards. When I was running Farrer Park Hospital, we had, I think, about 24 awards by the time for the period that I'm there, for 24 months. So it's kind of like an award a month on average. Yeah.
Yes.
So basically, it's not just winning awards. It's something that I wanted the staff to feel that it's them. They are working in an award-winning hospital. They need to make sure that they have that award-winning spirit, that award-winning behavior, right? In terms of providing the service and the experience to the customers. So it's like Singapore Airlines. It's the most awarded airline in the world. So when I was running Gleneagles, I wanted Gleneagles to be the most awarded private hospital in Singapore, and we did achieve that. So it's not me alone. It's actually the staff's award together.
Yeah. So it's like they're proud to work for such an organization, right? Award-winning organization.
That's correct. I mean, if you look at the Singapore Airlines staff, right, or the Singapore Airlines stewardess and stewards, they feel proud.
Yes. Take pride, right? Yes.
Yeah, I'm like SQ.
Yes. And like what you say, leader success is delivered through people, it's through the team. So your emphasis really on collaboration and trust and service creates a foundation for outstanding leadership. Great. The COVID-19 pandemic has reshaped the healthcare landscape globally. From your perspective, what lessons have emerged from this crisis regarding leadership, adaptability, and even resilience? How do you envision these insights shaping the future of healthcare leadership?
I think in leading any organization, whether it's healthcare organization or any other organizations, we need to be flexible and adaptable. At the same time, to have an open mind, because things change so fast. Even with the pandemic, we don't really understand the virus, the COVID virus, and the virus changes, right, so quickly. So we need to have an open mind in terms of changes, flexibility, adaptability, and we need to embrace that change. So we need to be able to demonstrate that so that the staff will feel that the leaders are very flexible and also wanting them to be safe. But a culture of caring and sharing comes into play here, and instilling the comfort feel of security in them, that we cover their back, they cover each other's back. You know, it's very important in any organization.
Yeah.
So what I would say is that empathetic leadership is when we care for our people will reciprocate. And that is the theory of reciprocity.
Yes.
Where people will evaluate kindness of action, not only by its consequences, but by its underlying intention.
Exactly. Yeah, absolutely. During times of crisis, right, it's important to be flexible, adaptable, and even show empathy, especially important. How do you think effective leadership practices contribute to reducing stress and preventing burnout among healthcare professionals? So Dr. Tim, could you share some specific strategies you have observed or implemented to promote mental well-being in high-pressure healthcare environments?
Well, knowing that our staff can rely on each other, right? Because if we've created a caring and sharing culture, when you care, you share. So with that culture, we cover each other's back. And also the leader's support is very important, whether it's emotional support, whether it's mental support, or even the physical support, because everyone is so tired. This will help the staff to lessen the effects of the burnout that all of us feel. So knowing that they are not alone, and they're not the frontliners who are bearing the brunt all the time. So empathy, again, empathetic leadership.
Yeah, care.
Yeah, care. Rest and relaxation is important. In between, we need to have programs that are put in place. Meditation program, yoga, tai chi has been instituted. Those who want to participate, and of course, we do have counseling by the professionals. Should they need the counseling, it is available. But one very important aspect is, I don't know, previously we were not talking so much about it. It's forest bathing.
I heard.
You heard of it, right?
Yeah, getting popular.
Getting popular now, but pre-pandemic, although people go walking in Bukit Timah Hill, but they don't sort of say I'm forest walking.
Yeah.
But
now this is used.
Forest bathing. I mean, it's now known as forest bathing. It's another form of mental health relaxation. It's free anyway. Forest bathing.
Nature, very nice. Yeah, to be in the nature, the greenery. Yeah, very nice. Yes. So thanks for sharing, Tim. Creating a supportive environment where people feel connected and supported is essential to promote mental well-being, especially in high-pressure environments. Let's talk about the initiatives that you have seen or implemented that successfully integrated employee engagement strategies with mental health support within the healthcare organizations. How do you think these initiatives promote work-life balance and foster a culture of supportive workplace culture?
So I would say communicate. Or over-communicate. So,
yeah.
But regular and consistent communication is important. The word consistency. We can communicate, but are we consistent? So consistent communication is important. Education on mental health. Sharing of stories amongst each other. I'm sure all of us have some stories to share in terms of how we feel or what we do, or certain areas that we can share in terms of activities. Having tea with your HODs, head of departments, having breakfast with me when I was running the organization. All these provides an outlet for engagement. So staff engagement is very important when we are looking at initiatives to be put in place. One other area is that you can have an app. Because in healthcare, about 60% of healthcare people in the organizations, or especially in a hospital, they do not have an email or a laptop.
Yes.
Okay, right. Just consider nurses. There are 40 nurses in the ward, but only the head nurse has a sort of a desktop in her office, but the other nurses are just running and doing whatever they do outside, right? So 60% of healthcare workers do not have a laptop and email, but we can do a company app. Having a company app, you can have communication on it. You can put bite-sized education. You can have gamification on the app. And these are all staff engagement ideas that we can put in place. Think about the initiatives to connect, communicate.
Yeah, thanks for sharing, Tim. These initiatives contribute to fostering a supportive workplace culture where employees feel valued, heard, right? Like what you say, communication and connected. Given your expertise in mental health advocacy, how do you believe effective leadership can drive initiatives to reduce stigma, increase access to mental health services, and prioritize mental health within healthcare organizations?
I think you're the mental health expert.
Thank you.
We got to bring Siren in for mental health initiatives for the organization, right? So I would say get the professionals to come in this aspect. Although we can provide professional counseling, mental health support professionally, but more of the mass mental health initiative. That's your expertise.
Oh, thank you. I love what you say. Thank you, team, for your support. Okay, great. Let's talk about resilience and coping strategies, which are essential for both healthcare, leadership, and mental health advocacy. Can you share some insights, right, on how leaders can cultivate resilience in themselves and their teams, and how individuals can maintain their mental well-being during challenging situations?
Leaders are humans, so we need to make sure that we have self-care. Self-care is very important. Don't underestimate self-care, because we think we can provide care for people, but we always forget care for ourselves. So first and foremost, self-care. If you look at the airline, right, the aeroplane, if there's anything that happens and the oxygen mask comes down, the announcement is always put the mask on yourself first.
Exactly.
Right? And then you put the mask on your child or whoever. Right? So self-care. When you have self-care, then you can give community care to your people. Right? If you're not healthy yourself, you cannot take care of others.
Exactly. I really love your emphasis on self-care. We need to be healthy first before we can take care of others. That's what I preach as well. Thank you.
Wow.
in my keynote speeches as well, yes. All right, great. Let's talk about psychological safety. Creating a culture of psychological safety is crucial for promoting open communication and addressing mental health concerns within teams. How do you recommend leaders foster such a culture, destigmatize mental health issues, and promote supportive relationships among team members?
I think that the topic of mental health has already been discussed a lot during this pandemic, because every one of us, whether you're a leader or whether you're within the organization, every one of us has a certain level of mental stress. And mental stress, whether we can manage the stress well, is another thing. So in terms of providing the support, I think everybody needs to help each other, need to understand the environment that people are in. And there's no stigma now. Previously, yes, pre-pandemic, people are very afraid that if I were to talk to a counselor or if I were to see a psychiatrist, a psychologist, it means something is wrong with my brain, something is wrong with me. Yeah, but through the pandemic, even doctors, they do have mental stress, they do have burnout, and that psychological stress needs to be addressed in different ways. So different people has different levels of mental health issues, which needs to be addressed in different components in different ways. And I don't think there's any stigma now. Like wearing a mask, if you wear a mask now, no one will say anything. If you wear a mask pre-pandemic, people will say, "Oh, what's wrong with you?" Yeah.
Yeah, it's really important to create an open and forgiving environment for psychological safety.
That's correct. Yeah, psychological safety is something that is very, very important in terms of a safety net for people to express themselves, to say that I need help. It's now like it's okay to say that I'm not okay.
Yeah, exactly. It's what we preach, right? It's okay not to be okay.
Yeah, I mean, if I'm not okay, I just tell you I'm not okay, and I need support.
Exactly. That's right. Good. Is there any final message that you'd like to share with our audience before we close the session?
Yes. I think I would like to say that people don't care how much you know until they know how much you care. And with that, I would say thank you very much.
Thank you, team. It's exactly what I also share with the leaders during the leadership skills program. People don't care what you care, they know you care.
That's right.
Thank you so much for the powerful reminder. And thank you so much, team, for sharing your invaluable insights and experiences. And to our listeners, thank you for joining us. Bye-bye.
Bye.